Do you know the color of your stool can reveal a lot about your health? Today we are going to talk about 7 things your toilet can tell you about your health. Let's start with number 1. What stool color reveals about your health? You may think this is gross, but there's actually a lot of truth to it. The color of your poop can be an indicator of your overall health. For example, if your stool is red, it could be a warning sign of something more serious, like colon cancer. That's because the digestive system contains a lot of blood vessels. So if there's bleeding in your colon or rectum, you might see blood in your stool, which can appear red. Of course, this isn't always the case. Sometimes the stool might just pick up some red dye from food coloring in your diet. But if you notice any change in your bowel movements, it's always best to check in with your doctor. They can determine if there's an underlying issue that needs to be addressed or if it's something more benign. Remember, early detection and treatment are key for any potential health concerns. Number 2, colonoscopy. If you've had the opportunity to get a colonoscopy done, you may have noticed a significant difference between the experience on an Indian toilet versus a Western toilet. On an Indian toilet, the sitting position during the procedure allows for a straighter view of the colon, making it easier for the gastroenterologist to identify any abnormalities or polyps. In contrast, when using a Western toilet, the lying down position means that the gastroenterologist has to work with a curve in the colon, which can make it more challenging to visualize the entire digestive tract. Additionally, the limited access to the anus during the colonoscopy on a Western toilet can make it harder to identify any issues in that area. Overall, the Indian toilet seems to provide a more thorough and efficient colonoscopy experience, leading to better detection rates for colorectal diseases such as cancer. However, it's important to note that both types of toilets have their own advantages and disadvantages, and ultimately, the choice of which one to use comes down to personal preference and availability. Number 3, jet spray vs. toilet paper. There's been a long-running debate about whether jet sprays or toilet paper is the best choice for personal hygiene after using the toilet. While both options have their pros and cons, the rising popularity of bidet attachments and bidet seats suggests that people are increasingly choosing the former over the latter. One of the main arguments in favor of jet sprays is that they are more hygienic than toilet paper since they eliminate the need to touch your anus with your hands, which can spread bacteria. Proponents also claim that the water pressure used in bidet sprays is gentle enough to clean the area without causing discomfort or tissue rotation. Another advantage of bidet sprays is that they can help prevent hemorrhoid flare-ups by reducing the need to strain during bowel movements. Ultimately, the decision of whether to use a bidet spray or toilet paper comes down to personal preference. However, considering the potential health benefits associated with bidet use, it might be worth giving it a try. 4. Constipation is on the rise today because our diet lacks fiber and we don't get enough physical activity. Also, many people don't drink enough water. It's important to address this issue as constipation can lead to more serious problems like piles, fissures, and fistulas. Piles are swollen veins in your anus and rectum, while fissures are small tears in the lining of the anus. Fistulas are abnormal connections between your anus and rectum and other body parts like the vagina or skin. These conditions can cause pain, bleeding, and discharge. And if left untreated, they can become more severe. That's why it's important to consult a doctor if you're experiencing these symptoms, so they can recommend treatments like medication or surgery. Prevention is also key, so be sure to eat plenty of fiber and stay active. Number 5, colorectal cancer is preventable with regular screenings. Early detection is crucial for successful treatment, so please follow your doctor's advice and stay on top of your screening tests. It's also important to maintain a healthy diet, exercise regularly, and avoid tobacco. By taking these precautions, you can significantly reduce your risk of developing colorectal cancer and keep yourself in tip-top shape. Number 6. Our gut is connected to our brain by the gut-brain axis, which means that what happens in our digestive system can affect our mental health and vice versa. Studies show that people with certain mental health conditions like anxiety and depression are more likely to develop gut issues like irritable bowel syndrome. That's why it's important to take care of both our gut and our brain health. And don't worry, you don't have to be a hippie about it. Just eat healthy foods, exercise, and get some sunshine. 7. Women are at a higher risk of developing colorectal issues like constipation, hemorrhoids, fissures, and fistulas. This is because pregnancy and childbirth can cause pelvic floor damage that affects the anal canal. To prevent these issues, women should prioritize their gut health by eating a high-fiber diet, staying physically active, and avoiding constipation. It's also important to practice good anal canal hygiene by cleaning the area thoroughly after using the toilet. This can help reduce the risk of infection and inflammation, keeping everything fresh and healthy down there. It's time for a bathroom break. We've covered a lot today, from the importance of addressing changes in stool color to the surprising benefits of the Indian toilet. Remember to prioritize your gut health. Don't take constipation lightly and make anal canal hygiene a must-do. If you enjoyed this video, give us a thumbs up and subscribe for more health and wellness tips. Thanks for watching, and happy pooping.